I think that we've all got this visual of Tua stuck inside our heads. So let's talk about what a normal return to play process should look like given what actually happened inside his skull. The return to play process is 6 stages, starting with stage 1 of symptom limited activity. So basically we're saying, hey Tua, do whatever you want normally that's not going to put your head at risk of contact, and as long as your symptoms don't get too much worse. And that's what he should have been doing for the first few days. Now by about day 4 to 5, since he's in the NFL, he probably had access to a treadmill test or a bike test, and that's where we're going to prescribe aerobic activity. So a way to increase the heart rate, to normally increase exercise tolerance. And in most people, that's going to take about 12 to 13 days to get back to normal. This is also exactly why you don't want to return him at day 7, which is what they did the first time. After stage 2, when he's demonstrated exercise tolerance, we're going to move on to stage 3 or sport-specific activities. So he's going to run, he's going to pass, he's going to do different things that are more sport-specific to increase dynamic movement with still no risk of head contact. When he can do that comfortably for a few training sessions, we're going to move on to stage 4, which is non-contact training or practice. He's going to throw a different jersey on. People are going to know not to hit him. And he's going to do things with more cognitive load, more dynamic, sort of sport-specific things going on. Now, in an ideal world, once he's done some non-contact practice, ideally 2 to 3 sessions, he's going to go through an exertion protocol and retest his baseline test. And then he can move to full contact practice. So it's preferred that he does an exertion protocol, and it's preferred that he does 2 to 3 full practices of full contact before he actually returns to play. That is stage 5 of the protocol. Stage 6, gameplay, baby. Go on. Now, how long does this take? The normal return to play window for most athletes is 21 days. It can be as long as 59 days, depending on like migraine history, anxiety, different things like that. But this is kind of the window here. That bar is kind of the window when most athletes return to play. The tricky part is that most people, especially healthy athletes, are going to feel better within about 5 to 10 days. Symptoms are gone in 5 to 10 days. So what happens if we return them in this 5 to 10 day window? We see most return to play protocols only last 6 to 7 days. What's the problem with that? The problem is exactly what we saw with Tua, where an early return risks a significant metabolic injury if you reconcuss yourself. So you can see here, you're just compounding the metabolic deficit. And when that happens, we see longer recovery times, more severe symptoms, possibly disability, and even fatality. That hit on Tua, that second hit, could have actually been a career-ending hit, maybe even like something that quite frankly fucks up his life because we mismanaged that first injury. This is why proper assessment and rehab is so important. In that stage 1, get assessment, get a proper assessment. In stage 2, when you're doing that aerobic exercise, do the aerobic exercise, but also do the visual, the vestibular, the cervical spine work. Once you've passed that exercise, start doing more dynamic work, add resistance training, add dual tasking, add proprioception, and you'll be ready to return to play. Something you might not realize is that a concussion, when treated properly, lasts about as long, possibly even faster than an ankle sprain. Meaning if you sprain your ankle, it takes you out longer than your concussion.